Good evening. Thank you for allowing me to speak. My name is Matt Perry, P-E-R-R-Y. I'm a medical student at Brown University and a resident of Providence. Here to talk a little bit about the health impacts of the proposal and about my own experience and observations with the way that usually works. I just came over from my pediatric clerkship where we had a lot of asthma cases. It's November and we're seeing a lot of asthma. And when you sort of break down who comes through the clinic with asthma exacerbations and who gets hospitalized with asthma exacerbations, there are trends that pop up that you start to notice, and then you kind of break it down by statistic, and you notice that the highest rate of asthma in our entire state and asthma exacerbations is the single neighborhood of Fields Point, which is the neighborhood where this proposal is. And that every single toxic polluter, all 11 toxic polluters in the state of Providence are in that one neighborhood. That's not a coincidence. Other folks tonight and last hearing presented the dangers, violations, and ethical problems of the project a lot better than I can. But last week it was like hearing two different languages spoken. I heard folks talk about their experiences with health, with their neighborhood, and I heard a bureaucratic response of self-imposed restrictions of the scope of this committee. A decision that you all have made about the scope of how you can make your decision. And that's a narrow scope. So why can you afford that narrow scope? It's because that scope doesn't include your kids' lungs. It's because that scope doesn't include the view from your balcony of your neighborhood. And you can afford to see this as just your job, as just what you do from 5 to 8 on Tuesday night. And you can create these pockets, right? And you can afford to see this plant as just one liquefaction facility. You don't have to look at the scope of all 11 toxic polluters in a single neighborhood. But the lungs of the kids who live in that neighborhood can't define themselves in a vacuum like that. The folks who live in that neighborhood can't define themselves in a vacuum like that. And we all, quite frankly, can't afford to see our community in a vacuum like that because we have one community. And for you to limit your purview willingly is a choice that you've made. It's not a default. So other folks have made the case why it is in fact within your ability to shut down this project. And the rest of us are trying to make the case of why it should be in your ability to shut down this project. In medicine, we have lots of drugs that do a lot of different things. And we don't say to somebody, I'm sorry, this drug was invented for kidney disease. Even though it effectively can lower your blood pressure, we're not going to give it to you because its original intention was kidney disease. You should stop this project and you can stop this project. So please do.